Hello, everyone, and welcome to Vital Terms, the medical terminology podcast curated by Language Access Academy. Today, we dive into the fascinating world of the nervous system with a mix of science, fun facts, and a dash of inspiration. I'm your host, June.
And I'm your co-host, Joanne. Today, we're embarking on an enlightening journey through the intricate network that makes us who we are.
Let's kick things off by exploring the amazing anatomical structures of our nervous system. At the heart of it all, we have the central nervous system, CNS. That's the brain and spinal cord all bundled up, serving as the control center for our bodies. Within the brain, we find stars like the cerebrum, responsible for thinking, decision-making, and emotions, the cerebellum, which coordinates movement and balance, and the brainstem, a crucial area that manages breathing, heartbeat, and other life-sustaining functions. We also have the diencephalon, a region that includes the thalamus, the brain's relay station for sensory information, and the hypothalamus, the regulator of hormones and body temperature.
Absolutely, June. And did you know that the ventricular system, those fluid-filled spaces inside the brain, acts like an internal shock absorber, cushioning delicate tissues from injury? Now, moving over to the peripheral nervous system, PNS, imagine it as the vast highway network that connects every part of your body to the CNS. It includes cranial nerves, which emerge directly from the brain to serve the head and neck, and spinal nerves, which branch out from the spinal cord. We also have the autonomic nervous system, split into the sympathetic nervous system, our body's accelerator for fight-or-flight responses, and the parasympathetic nervous system, the system that calms us down and helps with rest and digestion. And a fun bonus, the enteric nervous system is often called our second brain because it governs the function of our gut.
Let's dig a bit deeper into the cellular world. Our nervous system is built with neurons, specialized cells that transmit messages throughout your body. Think of them as tiny messengers carrying important signals. Supporting these neurons are glial cells, which are the unsung heroes. Astrocytes, these star-shaped cells, help maintain the environment around neurons. Oligodendrocytes, they produce myelin in the CNS, which is like insulation for nerve fibers. Schwann cells, similar to oligodendrocytes, but they work in the PNS. Microglia, these are the immune cells of the brain, protecting against infection. Ependymal cells. They line the ventricles in the brain and help produce cerebrospinal fluid. And here's a fascinating fact. Neuroplasticity is the brain's ability to reorganize itself by forming new neural connections, which means we can continue learning and adapting throughout our lives.
That's truly inspiring, June. Now, when it comes to communication within our nervous system, we rely on neurotransmitters, the chemical messengers that bridge the gap between neurons. For example, acetylcholine helps with muscle movement and memory. Dopamine, involved in pleasure and reward. Serotonin influences mood, sleep, and appetite. Gamma-aminobutyric acid, GABA, acts as a calming agent by reducing neuronal excitability. Glutamate, the main excitatory neurotransmitter, fueling brain activity. Norepinephrine, also known as noradrenaline, it plays a role in alertness and arousal. Endorphins, natural pain relievers that boost our mood.
It really is a symphony of chemical signals. But every epic story has its challenges. In the realm of neurological disorders, conditions like Alzheimer's disease, a memory and cognitive decline disorder, Parkinson's disease, characterized by tremors and movement difficulties, Huntington's disease, a genetic condition causing progressive breakdown of nerve cells, and amyotrophic lateral sclerosis, ALS, which affects nerve cells controlling muscles, remind us why brain health is so important.
And then there are demyelinating disorders like multiple sclerosis, MS, where the protective myelin sheath around nerves is damaged, and Guillain-Barré syndrome, which affects the PNS. These remind us just how delicate our neural connections really are.
We also face sudden challenges like a stroke, a disruption of blood flow to the brain, or a transient ischemic attack, TIA, a brief stroke-like event. And traumatic events such as traumatic brain injuries, TBI, or spinal cord injuries underscore the importance of every moment for brain health. On a lighter note, the nervous system is also familiar with conditions like seizure disorders such as epilepsy, where sudden surges of electrical activity in the brain cause seizures, and common headaches like migraines and tension-type headaches, each telling a story about the balance and sensitivity of our neural networks.
Now let's talk about how we take a peek inside this amazing system. Diagnostic techniques are our window into the brain. Magnetic resonance imaging, MRI, uses magnetic fields to create detailed images of the brain. Computed tomography, CT, combines X-rays to form cross-sectional images. Positron emission tomography, PT, shows us how tissues and organs are functioning. Ultrasound, sometimes used to examine structures in the periphery. We also use electrophysiological studies like electroencephalography, EEG, records electrical activity in the brain. Electromyography, EMG, measures muscle response to nerve stimulation. Nerve conduction studies, NCS, evaluate how well and how fast nerves can send electrical signals. And procedures like a lumbar puncture or spinal tap allow doctors to analyze cerebrospinal fluid for clues about nervous system health.
Diagnostic advances not only save lives, but also spark hope by pushing the boundaries of what we know about the brain.
And when it comes to interventions, surgical procedures like a craniotomy, opening the skull for surgery, and laminectomy, removing a portion of the vertebral bone, demonstrate the precision and courage of medical professionals. Cutting-edge techniques like deep brain stimulation, DBS, where electrodes are implanted to regulate abnormal brain activity, and neuroendoscopy, a minimally invasive procedure, are nothing short of miraculous.
Beyond surgery, methods like neurorehabilitation, therapies to recover neurological function, and pharmacotherapy, using medications like anticonvulsants or cholinesterase inhibitors, are changing lives every day. Before we wrap up, let's not forget the essential role of the neurological examination. This thorough checkup includes cranial nerve assessments, testing the nerves that control our senses and movements, reflex testing, for instance, the Babinski sign, which is used to assess neurological function, and evaluations of sensory and motor functions, ensuring that every pathway is functioning properly.
Every step of the way, from diagnosis to treatment, reminds us of the amazing complexity and resilience of the human body. Each challenge in the realm of neurology brings us closer to understanding ourselves and advancing science for a brighter, healthier future.
Thank you for joining us on this enlightening journey through the nervous system. We hope today's episode has sparked wonder and inspiration in you. Stay curious, keep exploring. Until next time, take care of your brain and let your curiosity run wild.